everyone. I hope you're going to enjoy tonight. We're going to have some fun. It is really a neat tonight. We're going to have Dr. Marshall Freilich, and he's an oral surgeon out of Toronto, Ontario, Canada. And he will be sharing a little bit. Also we have with us Mr. Ben Lister. Ben was an early adopter of our light a while ago, and he's been able to see how it's been able to help in his family. So I think you're going to enjoy that. We wanted to tell you that also we will have at the end of the month, we will have a draw for all of those that stay with us to the end of the webinar here. By next, at the end of this month, June, we will have a draw for a Super Palm 1050. That's this guy here with the 660 and the 1050 nanometer wavelengths. So we'll have a draw for that. That's a $2,200 machine. We'll be sending that to one happy person that wins this month's giveaway. We will also have a time where I will open up for questions and answers. Please feel free to start thinking about your questions. And we're going to, in a moment here, get a video started, which explains a little bit about PBM. And so just want to welcome everybody tonight. We have a number of people from different parts of the world joining us today, and we welcome you all. So here we go.
PBM stands for Photobiomodulation. Photo being light, bio being biology, and light, well, light coming from some kind of source. In this case, PBM is used to help stimulate healing in the body, whether it's an LED, whether it's a laser, whether it's a sun, but that light comes through the skin layers, and actually the cells are able to absorb that light, converting it to energy. And then there's a host of different processes that are stimulated because of that light. So you can speed up healing. You can do different things that is very beneficial for the cells themselves, for healing, for reduction of inflammation, and a host of other things. Kerber USA is a company that we have set up to promote healing for the US and around the world. We would like to see this technology help a lot of people. We use LED technology where we can provide high amounts of light into the body, and that stimulates healing. I'd like to introduce you to the SunPowerLED Palm Ultimate. This device here has the most power of the series of devices. This light can produce a huge amount of light that can enter into the body and help speed up that healing. In this device, we have two different wavelengths. It's 660 nanometer, and as you can see, it's very bright, but it's very effective. You will cause a systemic effect with this wavelength of light. The other wavelength is 810. It's not very visible, but it penetrates very deep, and that can help as well reach the target that you're trying to reach. The main part about this light is that we have the power behind it and the large surface area that can reach very deep into the body. We believe that our product is the most powerful LED cluster under the sun. We have specification of this device of 150 milliwatts per square centimeter, and that is over this entire area of 40 square centimeters. It also provides a wall of light that comes through the skin and is able to reach depths that have never been able to be done before with other light products on the market. There's an interesting biblical passage in Malachi 4:2 that talks about the healing that comes from the rays of the sun. And that's what we're trying to do. We're trying to provide healing with these rays. PBM has also been shown in various studies to be able to help promote healing in wounds such as diabetic ulcers, venous ulcers, and other areas where cuts or burns or other types of wounds are on the skin level. If you have any questions about PBM and how our light device, the SunPowerLED Palm Series, can help you, please reach out to us and we'll get back to you as soon as we can.
Okay, well, now what I'd like to do is I would like to, I noticed that we have had a number of other guests join us. So at the end of this, if you stay to the end, there's a draw for the Super Palm 1050, a $2,200 device. That draw will be at the end of the month. So, and tell your friends about it. I know that lowers the odds a little bit, but tell your friends to join us sometime. Anyways, the next guest I'm going to have is Ben Lester, and Ben will be joining us in just a second here. Yeah, so Ben, probably, I think it was over a year ago that he got the bottle light from us, and what was it about? How you got to unmute there, Ben? There we go.
Hello, Tom.
Oops, you're still, we're good? Okay, great. Okay, all right, go ahead, Ben. So about when did you get the light from us?
You know, I was thinking about that. I didn't have time to go through my records, but I think it was roughly a year ago.
Right.
And through a mutual friend of ours that I found out about your system, Tom.
Okay, yeah. Josh from Buffalo.
Right.
Yeah. And then, so up until that point in time, had you heard anything about light therapy ever? Nothing.
Negative.
And if it wasn't Josh telling you about it, would you have believed that light could make a difference?
Highly doubtful, as a matter of fact. Josh is a very trustworthy individual, so I took him at his word, and I'm glad I did.
Yeah, great guy, great guy. So tell me, what was the first thought of yours as far as what did you want to use it for treatment?
Yeah, great question. So our second daughter, Hannah, was pregnant, and with her third child, actually had a number of miscarriages. And so she was being particularly careful and mindful of her pregnancy, but had been experiencing excruciating headaches and just debilitating. And she had been on several medications, but was very reluctant to pursue the pharmaceutical route because of her concerns for her pregnancy, and understandably. And so when Josh had introduced us to the LED system, I just asked him, I said, do you think that this could be a possible treatment? And so they sent us a light, and literally within 48 hours of getting that light to my daughter, Hannah, and her being able to administer the light and have some treatment time with that, she immediately got relief from the migraines. And so she ended up using the light system throughout her pregnancy. And now here we are. I guess the baby is, his name is Amos, was born very healthy and happy, is 3 months old now, and successful pregnancy. And so thanks to you and the system for helping her get through that. And she does not have any further complications from migraines at this point.
Yeah, and I understood in talking with her, and she's on one of our videos that people can go to. So if they go to the SunPowerLED website, there's a place where you can watch more videos under more from times that we've done these interviews. But your daughter, she's totally off medication and has been migraine free now.
That
And she
that is
was
correct.
she was at 20 she was at she said around 20 migraines a month is what she was experiencing, very
Right.
debilitating migraines. Yeah. And then what about yourself? You used it a little bit too?
Yeah, I've had some treatment on my lower back, which has been a little bit of an issue. I travel a lot, so and that's been helpful. I would say also notably my wife, who had an injury to her knee from being a gymnast as a young lady, had some surgery in her knee early on, and so from time to time that was giving her some pretty significant discomfort and pain. And so it was kind of a little bit of a fight for the light between Hannah and my wife to get time with the light so she could get her knee treatment. No, Hannah was a priority for sure. So Carol used it on her knee, which has stimulated a lot of healing there. Her pain is not nearly as frequent and is far less severe. So I would say 2 thumbs up.
Okay, that's fantastic. Well, I appreciate, Ben, your coming on tonight, and it's neat how you opened the door to help your daughter and yourselves. And now I know you've talked to others, and others have learned about this. But it's I just want to thank you, Ben, for coming on with us tonight. And I guess you don't feel any more at the beginning when you felt going to do any good. Now you've seen the light, right?
Yeah, we have seen the light, definitely, and we are big proponents of this system for sure.
All right. Well, thank you, Ben. That's great. So
Blessings, Tom.
thank you. Thank you. So next, we're going to have Dr. Marshall Freilich, and he is an oral surgeon out of Toronto in Ontario, Canada. And like to bring him on. And he has a wealth of experience in the oral area. And I welcome all the dentists that have joined us tonight in this talk. And Marshall, if you could, Dr. Freilich, if you can unmute your mic, there we go. And since I'm still learning all your background, can you just give us a quick synopsis of your background, and also, yeah, and then I'll go from there. Yeah, please.
Sure, Tom. Thanks very much for including me tonight. So, as Tom mentioned, I'm an oral and maxillofacial surgeon. But a few years back, basically around the time pandemic started, I decided that I wanted to expand my my scope a little bit, and entered into a advanced training program in the field of oral medicine. Which was a 3-year undertaking, formally and finally concluded about a month ago. And in the course of that, nobody had ever discussed photobiomodulation within that realm. And I'm very fortunate to have a good friend and mentor, Joel Epstein, who, Tom, I know you know quite well. And Joel was the one, when I was visiting with him back in December, he said, "Hey, have you seen this?" Because he had been using this in his practice for some time. And kind of along the lines of what you asked Ben, had it been anybody other than Joel that had put this forward to me, I probably would have shaken it off. But I've got tremendous respect, being a former student of his, and proceeded to come home. And one of the first things I did was to email your company and order one of these. And part of it was self-serving, thinking that I'll use it on my own aches and pains, and also wanting to put it into action in clinical practice, because there's certainly seems to be untapped potential with this in terms of the number of conditions we can treat. So that's been about 6 months now.
Yeah, and if you can mention a little more about Dr. Joel Epstein, as far as I got to know him now over the last year, and he's working with us. But if there's anything you can share about some of your some things that you don't mind sharing about what you're planning to do, and who is Dr. Joel Epstein? So I know him
Joel,
as a world-renowned guy in using PBM in oral. He's written a number of papers, but
yeah.
I'm probably giving a disservice trying to explain this. So please go for it.
I probably will too. I mean, aside from being a dear friend and mentor, Joel is probably one of the preeminent oral medicine experts in the world. He has published hundreds of peer-reviewed journal articles. His scope of practice essentially encompasses management of many conditions and diseases in the mouth, and with a special interest in dental oncology, managing oral complications for patients that are going through things like chemotherapy and radiotherapy in the head and neck. And so a large part of where I understand he's using PBM is to help heal breakdown of tissue in the mouth where ulcers can form. And this can be very, very painful for patients. And additionally, like we see in other parts of the body, he's been using it for facial muscle pain, temporomandibular joint pain, and even joint problems themselves. There also seems to be some evidence to support that this could be used to stimulate saliva flow in patients who are suffering from dry mouth and burning mouth syndromes and things that are traditionally very difficult for us to treat.
Thank you. Thank you. Yeah, I got a chance to, when I met Dr. Epstein, we started working together on the possibility for the oral mucositis, which you've mentioned. And it's expanded from there. We've working on some research with out of California for a special device that would go inside the mouth, which we have some prototypes right now of, and been testing it out. We, just like you say, we've got one person with burning mouth syndrome that it's quietened it down. And they've just more recently started. And then you have burning mouth first bite syndrome. That's tamed that down. Somebody's been very happy with that. What else? Oh, we had somebody improve with xerostomia. I mean, all of this is early. Obviously, we need more information, but for the most part, there's a pile of studies out there. There's some 7,000 studies that are on the website that a link to where you can type in any type of issue. But in the mouth, that you have issues within the mouth, it's pretty much, you can do the same type if you're trying to heal on the body, which I'll discuss a little later, or other things you can heal there too. So, so with your, what have you, now you haven't been, you kidnapped the unit for, instead of bringing it to the practice, you decided to check it out at home first for a while. So what have you been able to do there? What's happened?
Been able to really successfully control kind of the chronic back and neck issues that go with leaning over patients and doing surgical procedures all of these years. So I definitely self-use it. My wife uses it as well for similar things, back pain and hip pain. And it might have been Dr. Epstein that mentioned this to me, I don't know, but somebody had put the bug in my ear that this could be very effective for nail fungal infections. And I have been dealing with a very persistent one for about 4 years. I was diligently using what was supposed to be one of the top topical treatments on the market. Didn't want to use the systemic medication because it's very hard on the liver. And I was doing this every single day and getting absolutely nowhere. So on a whim, I just said, well, I'm going to put this light on my nail and see what happens. But I can't even say that I did this diligently. I didn't. And I stopped using the other medication. I would do it every now and then when I thought about it. And here we are, and it's essentially 98% resolved. It's really remarkable. I mentioned it to a chiropodist this week, and she kept coming back to laser because that was what she was familiar with. And I said, no, this isn't laser. This is probably something that's easier to use, certainly more cost effective. If you're running a small clinic and you're looking to contain capital expenditures, I said, I wouldn't look at laser.
Yeah.
Well,
that is phenomenal. And now you couldn't hold up any longer with just holding it at the house. Now you got yourself another unit, and it's on its way. So soon some of your patients will be able to enjoy that as well.
Well, we used it today for a patient who has suffered from chronic exposure of her jawbone as a result of medication she's required for her cancer treatment. And it kind of in lieu of surgical therapy, which hasn't been effective. So we'll see where that goes.
Some of the work that Joel has also, Dr. Epstein, we're good friends now. With Dr. Epstein, he talked about whether it's canker sores or, lip ulcers, or one of the dentists in California suggested that a number of people, whether it's COVID or whether it's vaccine injury, have had tinnitus show up shortly after the COVID or shortly after the shot. And so they've actually, she thought, why not try? It's some kind of nerve problem because this stimulates nerve growth and repair. So a few of her patients that had reported this to her, she says, well, just while I'm working on your mouth, here, put the light therapy on your ear, and they were able to see an improvement in their the level of tinnitus that they were experiencing. And as a matter of fact, since I heard that, I now know of a half a dozen people that have improved their tinnitus significantly. So different types of nerves. Your trigeminal nerve is supposed to be something. Now I can't say I'm getting more and more exposure of learning of the different applications. Another one's Bell's palsy. They're the one now. Normally something like that's going to take quite a while to resolve. And one of the patients in the US was able to, get treated and they, by one of the doctors. And it was a one-day event. Up till that point, a significant Bell's palsy. The next day, the treatment. So it's pretty wild. Sometimes that's not the norm. Somebody's going to have to get 10, 15 treatments or something like that. But just the people that you can help. So we've had different ones on this. At some point, I've got to introduce you to some more of my friends in the dental world that have had speaking engagements. So I want to thank you very much for coming on, and you can stay on as long as we'll just move you over.
For sure.
And, I'll go into another section here.
Sounds great. Tom,
thank you very much for joining us.
My pleasure. Thanks very much.
So what I'm very appreciative that he was able to take some time tonight and be able to share with you how this is possible, that this technology can make such a difference. So right now, I guess you could almost call it a commercial, but I do need to explain the product a little bit. And so here we go. So we'll just hang on. Oh, yeah, okay. We'll go for this. Yeah. So we're going to go into a slideshow right now. Okay. So if we can get the next screen, please. Okay, so I'll just tell you a little bit about the light. There's different lights and different wavelengths. And here's an example showing for all the dentists that have joined us tonight how the penetration differs. So if you look on your right-hand side on the 660, sorry, left-hand side, the 660 nanometer, you will see that it's a more of a red color. The right one is just the way the camera picks it up. But on the left-hand picture, you'll see where the light is actually penetrating through the wall of the cheek and partially through the gum, and depends on your video monitor, you may be able to see that or not. But on the right-hand side, it's very, very obvious with 810 nanometer as to how well the light penetrates, because you can see it going right through the cheek wall as well as the gum line, so right through. And this has been we've been able to see a lot of feedback with, okay, I'll come back to it, but when you have the before root canal. Anyways, they've been able to tame down those nerves, or even to the point of actually having it heal. I'm working with a professor, Professor Praveen Irani. He's published a lot of papers as well, and he talks about how you can actually use the light for the healing application. Next slide, please. This is just a quick view of a very low power light, because this is actually just showing what would happen with different wavelengths. If you were to talk about a low power light like this one that's in this slide, your blue would only go just a short distance into the tissue, whereas when you get to around 660 nanometer, it penetrates much deeper. And then if you see to your far right, 800, that penetrates much deeper. Now with more power, we actually go much deeper into the tissues than what's showing here. So it is possible, depending on the wavelength and the type of tissue, to experience going in 4, 5, 6 centimeters, depending on the wavelength and depending on the tissue that you're trying to go through. So when you're talking of going through fatty tissue tends to be very scattering. So there's a high scattering coefficient, so it doesn't penetrate as deep. But if you're going through more muscle tissue, other types, you will notice the penetration is deeper. So it is possible with our lights. We have 660 nanometer, 810 nanometer, and 1050, which is not showing on here, but 1050 has the potential to penetrate even deeper. Many dentists are used to the laser 1067 nanometer. Some who have experience with using that wavelength, and it's very successful as well in PBM. The different wavelengths have different effects though, and so there's benefit to both wavelengths, whether it's the 660 810 or the 660 1050 nanometer in our products. The next slide, please. Just as far as showing how this can speed up healing, you look at the right, this fellow, he had taken a pickaxe and ended up landing it just above his ankle and cut through his tendon. So as you can see on the left-hand side, his tendon is cut right through, and they had to join it up again. And then unfortunately, the surgery wasn't successful, so they had to go back in a second time within the week and reattach it again, and then sew that up. So that was 2 major operations in a week. And within a couple of days of the surgery, he was able to be down here at our facility and was able to use one of our larger lights. So he was able to treat this 3 times a day. And on the right-hand side, you can see the swelling. I don't have a picture of the swelling, but it was quite measurable. But in the case of in the course of 2 weeks, significant swelling and had been reduced, and you can see healing is looking really nice. And the neat part about this is that he was told that, well, that wasn't neat for him, but he was told that it was going to be about 6 to 9 months before he'd be back on his foot again and getting some walking in. Well, if we can go to the next slide, go ahead and play that. So that's 4 weeks after the surgery, and he's walking, not 6 to 9 months. So this really speeds up healing. And so whether it's on the foot or whether it's up on the up in the jaw, as people, or if you're doing an implant, these kinds of things, tooth extraction, you can promote healing. You can actually help for orthodontists to be able to move the teeth faster because of less pain and the way that the teeth are able to move faster with light therapy. So if I can go to the next slide, please. This is a really bad situation where this woman was going to lose her ankle, lose her foot through amputation. It was already scheduled 1 week after the basically what you see here with the picture. They were able to get the light. And as soon as they got the light, that's when this first picture was taken on the left-hand side. And within a week, they were able to cancel the surgery. And then you can see the picture 2 months post post the starting of the treatment, you can see how much that's healed, and then healed the rest of the way. So we've been able to save a leg. In this case, chest surgery, where you see the incision on the left-hand side and on the right-hand side, almost within 4 weeks, the type of healing that took place. And this person used the light daily. Next picture, please. My apologies for the light color, just the way the light was in the room. But on the left-hand side is his forearm, where they took out the nerve, the vein. And on the right-hand side, you'll see his leg. Now, the difference being not the color, because the color was the same. But if you look at the left, how smooth the incision is, I think you should be able to see that, and how utterly healed, like beautifully healed, and no swelling in place. Whereas on his leg, he decided that it was uncomfortable to get in a position to try and treat his leg. So he only treated once a week on the leg. So you can see, still looking good, but nowhere near as fast as when he was treating it. The quality is nowhere near what would happen because he treated daily. Can I go to the next slide, please? So we have different devices in our company. We have the helmet, which is looking at the left-hand side. Now, on the left-hand side, you see a fellow who had a concussion. And prior to his first treatment, this was actually 2 months after his stroke, and he was having a great deal of difficulty speaking. As a matter of fact, when I would talk to him on the phone, I literally would have to ask him to keep repeating what he said, because I could not understand it, what he was saying. And finally, after 2 months, he decided to come in and do a 4-minute light treatment. And the next day I was able to hear him clearly. Middle is a young man, young boy that fell from a 12-foot high fence, and he really rocked his head good. And he was, they did the analysis at the hospital, and quite the concussion that he had. So he was experiencing throwing up and nausea and headaches and double vision. And so after the first treatment was day 8 after the incident. And the first treatment, he had the patch over one eye because it was so severe, the double vision. And he had been wearing it for the week since the incident. And after when I saw him in the second treatment, he said he didn't have the patch on anymore. That second treatment was only 2 days later. This was a 3-minute treatment. And he was able to then, he told me though, he said that across the far side of the room, it's a little fuzzy, a little double vision kind of thing. He did the treatment and he came out. I didn't ask him anything. I just, I asked him how things were going and everything. And he says, oh, look at that. The wall is clear on the end there. So just in one 3-minute treatment, we're able to see some, however the brain works. I don't know. But it helped in his situation. Obviously, this light with the light therapy helps to increase blood flow and does a whole host of things. On the right-hand side, you'll see the canopy, what we call the full-size canopy. We have a mini canopy as well that's 1/6 the size of that unit, but you can see this unit can do the whole back and neck at the same time. So next slide, please. So TMJ was mentioned earlier, TMD, xerostomia, improvement with, if the saliva glands are totally destroyed by the radiation, it's not likely that that's going to repair that. But if there's any saliva flow whatsoever, there's a very good possibility that you can help restore the gland. And I've heard of reports of people talking about how this can stimulate flow, saliva flow. So also with the TMD and treating the different muscles, because it's such a large area, it can treat. It's not like some of the smaller laser devices that you could have to place in multiple spots. You can do the whole area in one shot. I can get the next picture. please. One of the big differences on our product is we call it the wall of light technology. We have a trademark on that. And if you look at the upper part, that's our device, the SunPowerLED. What we've done is with the LEDs, we use a very wide field coming out of it, 90 degree, as you can see, plus or minus 45 off the axis. And what that does is allow us to have a very, very even illumination at the treatment surface, which can be as close as 20 millimeter or approximately an inch away, which is when you put this device, it's got little knobs on it, and those knobs keep you at that 1 inch distance. So you, in this case, you have no hot spots in that beam. It's very, very even. Not only that, but because we have such an even amount of light over the entire area, we're able to really drive up the power so there's no hot spots on the skin, and you can get maximum penetration. Whereas other devices on the market that are out there can cost far less, but they just don't perform because they create hot spots. They don't have the penetration that we have because of they try and increase their light levels by putting really focused LEDs behind them, going into the 30 to 60 degree mark. But then all that tells you is that there's some really bright spots in the beam. And if I take a light and I do this, well, I'll go and I'll do it a little later, but it's such an even illumination out of this device. So next slide, please. So I just mentioned about lasers and LEDs. In this case, a laser of the same power as an LED. So I tuned my LED way down, the power out of it, and you can see through the finger that the illumination is very even. You know, what you would think that the laser was supposed to cause a bright spot after it goes through some tissue. No, that's not what happens. As soon as it hits the first layers of tissue, it starts scattering in all directions. So there's no more benefit to the lasers. Even if you've seen all the James Bond movies as to what you can do with laser light, but no, in this case, when you have a focused laser and it hits a LED surface, skin surface, it diffuses in all directions. So you don't have to spend 5 to 30 times the amount of money for getting laser devices when our LED device, it works very well. So next slide, please. Okay, another thing is because it's not a coherent light and it's very diffused, it's very, very safe to use. You can use safety glasses if you would, and as a matter of fact, probably should in the clinics, but for home use, dark side of sunglasses or even to use it as is. It's not because there's no spot that's going to come out that's going to burn the back of the retina. Next slide, please. Okay, well, let me just move on because our time is creeping away here. So I'll kill this part of the slideshow. So I'll just show you a little more about the product and then we'll get into some question and answers. So we have the different devices. We have the classic, which is our first device that we brought in. It's only a single wavelength, 660 nanometer. And so even though 660 nanometer is only, you know, is one of the wavelengths, we've seen some things happen with this light. Very, very good results, but not for depth. If it's really for depth, you need to move on with some of the other devices that we have. So we have what we call the Palm Professional, and the Palm Professional has the 2 wavelengths. It has the 660 nanometer and the 810 nanometer. And then, as I said, there's a large area, and I'll just show you here. I'll take a piece of paper here, and if I put it on there, you can see how even the light is over the whole area. And the same with the other wavelengths, but you just can't see it very well. That's that wavelength there. That's actually 810. You can see the lights in there. So we have the Professional that sells for $975. Then we have the next version up, which is the Ultimate, and the Ultimate has more horsepower. It's like you got an 8-cylinder car and you have a 12 cylinder, and this is the 12 cylinder. So it really gets the job done. And I got to say, there's a lot of toys on the market that are really the 1 cylinder. So if you're going to go up a hill, which kind of vehicle do you want to go with a load? Do you want to go 4 cylinder? You want to go 8 cylinder? Or you want to go with a 12 cylinder? So the Ultimate and the Super Palm are really, when you get into the devices that can have the extra power to do the job. So the Ultimate is actually it is 25% more power for both wavelengths. So it has the 660 nanometer, has the 810 nanometer. And if I do this, you can see the light is going right through my hand. And I've got a pretty bright area here to show. I have to shade it a little bit, but you can see that light going through. So we also have for an oral device that just goes into the end of this, and that allows you to do intraoral work. You can see it on our website. So it just snaps in. So any of these, or I should say, any of these devices minus the classic will allow you to put the oral probe on there and be able to focus it in on the back of the, on the area that you're trying to treat inside the mouth. It is possible, though, in many cases, just to be able to treat on the outside and have enough light going right through the wall of the cheek and treat that way. So we also have one more device here. So the Ultimate is $1,300. And then we have the Super Palm 1050. And this device is the newest one that we've developed, and we're getting some good feedback from it already. But it has the 660 nanometer, but the extra special part is it has 1050 nanometer. 1050 nanometer, I can look at it, I can't see it at all. It's totally invisible, but when I bring it up to the screen, you can see the purplish looking color LEDs. That's only because the camera puts it out that way as a purplish look. You'll notice the one red light here on the one side. And the purpose of that is when you look at this, if you didn't have that little red indicator light, you'd probably think nothing's working, but you can feel the energy coming from it, but you just can't see it. It's invisible. So that's the different devices. Some might ask out there, you know, how do I know, you know, these devices, by the way, have all been developed since the beginning of COVID. I have had other devices out there on the market. So going back 15 years ago, I developed a light using a halogen. And this device is actually was used to treat quite a number of people. We had it on the market, we have it on the market, but you can see the size of it, and you can see the size of the new one. And this is very light, and this is very heavy, and they put out roughly the same energy. So, and that's just one wide spectrum, and this is the unique spectrum coming out of the LED devices. So I've had these devices out there already for 15 years. I made a large bed that person could lay on. We also developed a chair early on. We were able to see these go to some chiropractors, and other people bought them personally for back pain, neck pain, that kind of thing. And but now more recently, we have also the mini canopy. This device is on a stand, and you can turn it down and put it on over your bed, and or over treat sideways, do whatever you want with it. And it has the 2 wavelengths. This one here, which is the 660 nanometer, and 810 nanometer, which you can't see right now because of the camera. But it has 15 times the power and 15 times the area of our Ultimate. So you get an idea that this can treat a large area, as you can see in the picture behind me, how it can treat a larger area of the back. So this is our device for treatment of the head, as I showed in one of the pictures. It's our helmet. It has the 2 wavelengths as well, 660 and the 810 nanometer as well. And you can't really see that much No, you can't. But it's coming out of there. So at this point, what I'd like to do is I'd like to bring back Dr. Freilich. I think we can, and we can ask. We'd love to hear your questions now about these different things that come up during our webinar, or maybe we didn't explain quick enough. He's there. There we go. Okay, so we'll bring you back on. And so I encourage people to ask questions. Fire on the chat line there. We will see them and respond. Can we hear you okay? Are you there, Marshall?
Oh yeah, I've got questions
beautiful.
too. So
excellent,
yeah.
excellent.
Okay.
So we're totally ready now.
Yeah.
Okay, so yeah, all right. So one thing that people have asked is, just again, what areas are you hoping to use, or you've heard about already, that people have used this light therapy for in the dental applications? I know I covered some ground, but from your own perspective, and what are you hoping to do as far as treatment in your practice?
So I'm hoping to, as I'm now expanding into oral medicine within my own scope of practice, we'll be helping patients with various erosive and ulcerative conditions, things like lichen planus, again, oral mucositis, aphthous ulcers. We can accelerate healing for a lot of those patients. Basically, anything that presents with non-malignant ulcers, there's a role for this. Within the TMJ realm, as we've talked about, whether it's muscle or joint pain, we'll be offering this to patients as well. And it'll be interesting to see what happens with the hyposalivation patients too. So those are really my main three. And then in the oral surgery realm, certainly there's some good early evidence, as you've touched on, Tom, that wound healing and bone healing in particular can be accelerated with this. So we'll start using this routinely in a lot of our surgical sites and see if we can measure some differences.
Yeah, I had Joel, Dr. Epstein had mentioned to me about, and I ended up actually talking to the patient as well, but they had a bone graft done and it wasn't taking well. And they had a long time, it was a long time that they were trying to change the situation. You know, it's pretty ugly as I understand it. And he worked with Dr. Epstein using the PBM light that we've developed, and was able to see a significant improvement in his.
And that makes sense. That makes a lot of sense. You know, looking at the way the physiology behind this, the way inflammatory mediator markers are reduced, and bone grafts, typically they get into trouble, have relied on other things like hyperbaric oxygen therapy, other medications to try to stimulate wound healing factors, whereas the light system seems to do that a lot more easily. So I think, as you showed with that case with the severe diabetic ankle situation, I think there's tremendous application of surgery for it.
Yeah, so we got our first question. I'll take this one. So the question was, do you use, this is from Nolan, thank you for your question. Do you use this treatment with methylene blue? What I do know is that there's a possibility of methylene blue being very helpful in bacterial killing and other types of applications. I don't know, I don't know, have you heard of anything along that line, Doctor?
I heard of it from Joel, and I actually have a bottle of it sitting on my desk waiting to try this out. So my understanding with it, Nolan, is that it can be particularly useful for patients with exposed bone problems like osteomyelitis or bisphosphonate-induced osteonecrosis. I just want to get a better handle on the best way to use it, whether it's a rinse, topical application. I know it's pretty messy stuff. I don't personally have any experience with it yet, but like I said, there's an unopened bottle on the desk. So I'll be delving into it because, you know, it seems like, and if I have the buzzword correct, now we go from photobiomodulation to photodynamic therapy, and there seems to be good supporting evidence for that, for sure.
Yeah. So they also use methylene blue for toenail fungus as well, to speed that up. So that's a very good question. And we will, as we go forward and learn more, we will be sharing more. But there's on the, you had mentioned, I'm trying to think right now what it was, but there's quite a number of articles, as I said, on our website. If you go into the research section and click on the area where we have the link to the website, it's PBM findings. You'll see a lot of research papers there on different things. Now with the methylene blue that was mentioned, that's a different area, as you mentioned, PDT. So that's up to the doctors and dentists directly. But the interesting thing, if you looked at the, so in the, I gotta get my, so in here, you have all the different wavelengths of the spectrum of the rainbow. And at 660 nanometer, there's a really high, like if you looked at the wavelengths of what will trigger the response with the molecules of 5-ALA, there's a high peak at 660 nanometer. So that's the best wavelength for that. So, okay, another question we have, if treatment cannot be used consistently, do you lose ground? I would say in some cases you do, and some, I have had some crazy stuff that I've seen over the years where one woman, she had severe pain for 8 years in her lower backs, and she couldn't sit. She could lay down, she could stand up, but she could not sit. She had such tremendous pain. And I figured she would need multiple treatments before she could see some improvement. She did one treatment, and I thought something was wrong when I saw her come out of the treatment room because she was crying. And I thought, oh boy, something really went wrong. And she said, no. She says, I can't believe this. And she was standing up, sitting down, standing up, sitting down. She sat on the floor, stood up again, and just couldn't stop crying the whole time. But that was the one and only treatment that she did. And she never did come back for more treatments because in her situation, whatever was going on with the nerve bundles or nerve fibers, however, it just improved that. But I've also seen where sometimes, yeah, this may be something that you're gonna have to have beside your bed or beside your toothbrush to treat on a regular basis. You wouldn't park your toothbrush away for a month or two. And neither should, once you start using this. As a matter of fact, one of the individuals, he had, as a matter of fact, he was mentioned in the earlier in our webinar, fellow by the name of Josh. He was actually introduced to the PBM through Dr. Praveen Irani out of University of Buffalo. Are you familiar with Praveen? Have you met him somewhere along the line? Okay, we got to put the two of you guys together. Sure. That'll be excellent. Be but he's a researcher out of University of Buffalo, and he's got over 20, I think now over 23 years of PBM research, and really knowledgeable. And this fellow Josh, who is a colleague, another professor in another department in the university, they knew each other through their daughters, but he found out that he was having seizures. And he suggested that the light could be used for seizures. And so during, prior to COVID, about 2 years prior to COVID, he got a series of treatments through the University of Buffalo on the area, and where they figured there was a lesion on his brain, and they treated that area. And when they did, this was over a 6-week time frame, and then he didn't have any seizures anymore. But then, or I shouldn't say anymore, 2 years later during COVID, the seizures had come back. And so at that point, because of the lockdowns and everything was happening in Buffalo, he wasn't able to do the treatment. So what was suggested was to use the light again, to get a light from me. And so he did. So he's treating his head now, and he's been 2 years seizure free since the start of using my light, because one of his colleagues cared enough to share that the light could be helpful. So that was pretty neat. So we have another question here from Dr. Jensen's son. I've used your Palm Ultimate. I can switch from the bright red to the lesser red. What wavelength is the bright LED wavelength? What wavelength offers the most penetration? Good question. So Dr. Sun, the Ultimate has both 660 and 810 nanometer. And with the 660 and 810 nanometer, the 660 is the one that's really bright, but the issue is that you will not have as much penetration as the 810 nanometer has. So both of them are beneficial, where the 660 has the possibility to treat more of the, it still can penetrate. As I showed, it went right through the wall of the cheek and further than that. I've had people using the 660 earlier on, but for knees and that. But if you're talking a shoulder and a hip, sometimes you need a lot more energy behind it. And so that's where we have the professional, also the wavelength of 810. And there's more benefit for the light when the 660 nanometer really bright for systemic effects. So it's affecting the blood in the area, and the 810. So even if the 810 does not the 660 doesn't penetrate all the way, you're affecting the blood, which then does affect that area. And the 810 is still possible to penetrate even deeper. And there's certain reactions that are occurring in the 660 range. They've learned about all those. There's new area in the 810, and now they're starting to learn about 1050 nanometer and the benefits of 1050. Some of that is overlapping, and then there's some unique stuff, and it'll only probably take another 10 more years before they find another whole layer of mechanisms they never knew about. But there's 7,000, like I say, research articles. So it looks like we've been able to answer all the questions. So I want to thank you, Dr. Freilich, for being on our event today. Thank you for helping me with some of the questions. And I'll just spend a few more minutes with everybody that's online here. But thank you so much. I really appreciate it.
Thank you, Tom.
So if you'd like to purchase one of these units, we're offering a 2-year warranty with the the Super Palm 1050. And that one's selling for $1,900. The Ultimate is the $1,300 one, and the Professional is $975. And so if you want to go to www.SunPowerLED, and you can see a lot of, there's some older dentists and doctors that we have, and we'd love you to be able to learn some more about how PBM can not only affect people within your practice, if you're in the dental field or in the chiropractic or physio, how it can help your patients, but also how it can be used at home. And because it's a smaller device and there's no batteries to recharge or anything, you just plug it in, and this runs off of low voltage, so it's extremely safe to use, and you can use it anywhere in the world with just a different adapter to plug into the outlet. So 220 is no problem anywhere else in the world that you go. So it's a really neat travel companion. So if you end up injuring yourself on a hike amongst some forested area, you can speed up that healing, or sprain your ankle or whatever. So we welcome you to, if there's still any last question, we'll stay on for another 2 more minutes here. And if not, we want to thank everyone for joining us. Because you've attended here to the end of the seminar, you will be also in for the draw for the end of the month. Yeah, so we welcome any questions out there. Also, you can email email your questions to info@sunpowerled.com. So I think we've answered the questions for now. So here's another question. So yes, we've answered that question, so we're good. And yeah, so thank you everybody for joining us. We would like to see this technology being used around the world. It can help so many people, even in areas that that's our goal, is to see this being used in countries that don't have two nickels to rub together. We would like them to be able to use our technology. So that's our desire, and I want to say God bless to everybody. I hope you have a next week. And oh, another quick question came in. Yeah, that's we're going to call it quits. So thank you. We can answer that last question if you send us an email. So thank you for joining us. God bless you. And please join us next week, Tuesday, and we will have another exciting guest or guests online for you. So have a great week. Bye for now.